Hi everyone, today I'm going to discuss about renal physiology, which is specifically for pharmacology of drugs. What is a nephron and what are its functions? Nephrons are basic urine-forming unit of the kidney. The initial part of the nephron consists of a capsule, which is called Bowman's capsule, and there is a tuft of capillary called glomerulus residing within the capsule. The glomerulus receives blood from an afferent arteriole, and blood exits the glomerulus via an efferent arteriole. The ultrafiltrate produced by the glomerulus enters a long tubular portion of the nephron where it is reabsorbed and conditioned. Each human kidney is composed of about 1 million nephrons. Proximal convoluted tubule. Normally, 65% of the filtered sodium is reabsorbed in this PCT. However, this part of the tubule is also highly permeable to water, and thus reabsorption in this unit is essentially isotonic. Move on to loop of Henle. So we can see loop of Henle as 3 different components: descending thin limb, ascending thin limb, and thick ascending limb. Descending thin limb is highly permeable to water, but its permeability to sodium and urea is quite low. In ascending thin limb, it is permeable to sodium and urea, but it's impermeable to water. For the thick ascending limb, it actively reabsorbs sodium and chloride, but it's impermeable to water and urea. 25% of filtered sodium is reabsorbed in this loop of Henle, which is mostly in the thick ascending limb, which has the last reabsorptive capacity in this loop of Henle. Let's move on to distal convoluted tubule. In this DCT, active reabsorption of sodium and chloride happens, and it's almost impermeable to water. 5 to 10% of filtered sodium is reabsorbed in this DCT, so it helps to produce more diluted urine. Component of the nephron is collecting tube. In this collecting tube, final adjustment of electrolyte composition for urine are made, which is mainly via the adrenal steroid aldosterone. Sodium reabsorption happens through this aldosterone action, and 2 to 3% of filtered sodium are reabsorbed in this collecting tube. This micro-learning video intends to help you to understand the basic renal physiology and renal handling of sodium and potassium to understand more on the pharmacology of diuretic agents. Thank you so much.